All right, hello and welcome to our episode on hypertension in the Black community. I'm your host, James Thomas III, Regional Manager with Providence Express Care here in California. As a reminder, the information provided during this event is for educational purposes only. If you have any questions regarding medical conditions or treatment plans, please consult your physician. Now let's get started. Joining me today is Dr. Daniel James Lewis, MD, Regional Medical Director of the San Fernando Valley for FACE Medical Group. How are you doing today, Dr. Lewis?
I'm doing very well. I'm doing very well.
All right, Dr. Lewis. So let me get started with these questions, okay? Dr. Lewis, can you share with us a little bit about yourself and also your journey of becoming a physician?
Nice. Okay, I can definitely do that. So a little bit about me. There's a little bit in this story for everyone. My mom's from Trinidad and Tobago. My father was born actually in Moscow, Russia. His father was a serviceman in the State Department. Was stationed in Moscow. Met his wife. Had my dad in Moscow, and during the war they moved to Washington D.C. So my mom, growing up in Trinidad, she eventually matriculated to Howard University, and there they met my dad. And a few years later, I popped out. So I grew up in Washington D.C. Some would call it working class neighborhood, all black neighborhood in D.C. My parents did divorce when I was about 4 or 5. So DC is a very interesting place. It is, when I grew up, it was Chocolate City and murder capital of the world, or at least of the United States. It was a fun place. I really enjoyed it. I went to Catholic schools starting in 4th grade, and believe it or not, I went to Catholic high school and the Catholic University of America. There in high school, I played football for a couple of years, and then in college, I played basketball. So there's a major sports theme to me. I wasn't really good at these sports, but I love playing them. Being 6'7" helps. I really have to credit my aunt, Patricia Sandiford, Dr. Patricia Sandiford. She was a pediatrician, and when I was 14, she said, what do you want to do with your life? And I said, I don't know. She said, think about being a doctor. And I said, okay. And I looked at her as a doctor and the procedures that came with it, and knowing where she grew up in a third world country really motivated me that, man, there's something about healthcare that's special. With the knowledge you have, you can really help people and help your own situation. So I listened to her. I wanted to be a doctor. My biggest accomplishment was I was the first one from my college to get into UCLA School of Medicine. Really proud of that. I was a class president at UCLA. And then I went to New York for my residency. New York is a very multicultural, diverse place, and the work was pretty hard as a resident, but it was fun. In 1999, I went to FACE Medical Group to work, and about 4 years into it, we had a board member that's stepping down. He said, I really want you to be on the board at FACE. And I said, really? Why me? And he said, I don't know, I see something special in you. And pretty much since 2004, I've been on the FACE Medical Executive Board. So that's a little bit about me and my motivations and my background.
Excellent. That's an excellent story. Sounds like someone took a chance on you back in 2004.
Yeah. I'll go also, people taking a chance in the Black community, I really feel has raised me up. I mean, I've had counselors and people involved that really pushed me and said, if you want to do this, this is how you do it, and this is what you need to do, and . So I really feel a big bond in the Black community for helping me be where I am.
Excellent. All right, I got another question for you here. In celebration of Black History Month, who are a few historical Black figures that have inspired you, whether it be personally or professionally?
Wow, so that's a great question. Number one, I'm a history buff. I really love history, and Harriet Tubman, I swear, I mean, this is out of control what she did with the Underground Railroad. She had 13 missions from her place in Maryland to Philadelphia in Canada to try to free enslaved blacks. I mean, this was awesome. So Harriet Tubman ranks at number one. My other figures tend to be sports related. LeBron James doing what he does at 37 is just out of control good. I really have a special place in my heart for the Williams sisters, knowing where they came from to reach the ranks they have professionally is just amazing. And also, Doug Williams. Doug Williams is the first black quarterback to win a Super Bowl. And he's from the then Washington Redskins. So a special place in my heart for him.
Nice, nice. All right, another question I have for you here. How did you become involved with the Black Physicians Council at FACey, and what drove you to become involved with DEI efforts?
Okay, well, it's a great question. So, it goes back to Ahmaud Arbery and the George Floyd situation. Just reading and watching it was just upsetting. And so being on the FACey executive board, I really said I need to try to use my talents in terms of administration organization to help form a Black Alliance. And so I outreached the Black doctors in FACey and asked them who wants to be a part of this. And we have 8 members, all of them really invest in terms of trying to help the health of the Black community. And it's also used as a sounding board, as a safe place for, the Black physicians at FACey to talk about the Black experience. So I really enjoyed it. It came together in August of 2020, and we decided a name. We came up with a mission. Our highlights is a vaccination project that we did, a webinar in February 6, 2021. We talked about the vaccine and its importance in the Black community, and it was great. So luckily, I've met up with Jeremy Elkins and Kenyon Beckman, who pulled me along to multiple projects, and we'll go into a little bit of that here in the future.
Okay, sounds good. Now to piggyback on that, I had a question. How can other providers become involved with this Black Physicians Council?
Well, that's a great question. It's a new organization, and we are still putting together members for other doctors and other groups. I would suggest, doing the same thing there in their medical group or their hospital system, talking to the Black doctors, trying to coalesce into a group and come up with a mission statement and really try to work for better health in the community.
Sounds excellent. Okay, let me read this next question. It says, in 2020, Providence announced it would invest $50 million over the next 5 years to improve health equity in our communities, beginning with mitigating the inequitable impacts of the pandemic. Reducing health disparities is a 2021 through 2022 advocacy priority. Can you provide some insight into the Providence Health Equity Hypertension Project?
All right, so it goes back to, with George Floyd and the Providence leaders saying that they were going to commit $50 million to help stop racism in healthcare. As an organization, I have particular pride for that, and I really respect the leaders of Providence for doing this. Number one. Number two, so when it comes to healthcare disparities, there's so many. It's kind of easy to find it, but one of the things that's glaring is cardiovascular disease in the Black community and hypertension in the Black community. Literally in Los Angeles, in terms of hypertension rates, the Black community is at 40+%, and the white community is at 17.5%. Major disparity there. So the powers that be got together and said, let's try to do something about this. I absolutely love this anti-hypertension project because it has so many moving parts, so many touch points in terms of the community and things that could potentially change. So the American Heart Association is a part of it, and American Heart Association has 80 faith-based and community organizations that they know of that they can help with the management and the diagnosis of hypertension. They have this program called Empower to Serve, where you can finish a training program of the Empower to Serve and then get a free blood pressure cuff, which is awesome. Another arm of this is called Live Chair Health, and Live Chair Health is a East Coast organization. And basically, it's a healthcare app, and it really is ingenious. Their president, Andrew Suggs, decided that where the action is tends to be at barbershops and salons in the Black community, and he came up with an app that helps track, manage, also organize healthcare via this app. And the more you interact with the app, the more benefits potentially you can get. If you follow your blood pressure, you get to see your doctor, potentially you can get coupons for a free haircut or salon service, ... So, there's just so many good things happening in this project. I'm really excited to be a part of it. I've signed up myself and the Black physicians at the Black Council at FACI to be a part of it, so we can be on their website as a referral for primary care or whatever services they need.
Excellent, excellent. All right, now how can our listeners and viewers participate in the Hypertension Project?
So hopefully the people behind the scenes will drop in the chat the website for this program. So there's a website. Go to it if you want to become involved. Please go to it and get involved. I mean, there are a lot of African American patients at Providence that we would love to be a part of this program.
Okay. All right. Now, Dr. Lewis, what are some healthy habits we can put in place to begin our journey of a heart-healthy lifestyle?
So, let's go into a little bit in terms of hypertension itself. Hypertension is not considered a disease process by itself, but more an association to vascular disease. So when you have hypertension, you're at risk for stroke, you're at risk for heart attack, you're at risk for vascular disease. And unfortunately, as I said earlier, it tends to affect the Black community more than other communities. So, to address that, what's the best way to address that? Yeah, see your doctor, get the medications that you need, but there's some non-medications too, non-medication treatments that can help. A good exercise program. And this is something in primary care we talk about all the time, 3 to 5 times a week. A good cardiovascular exercise, a half an hour, 45 minutes each. And then staying away from the foods that we know are absolutely delicious but not good for us. The fried foods, the sugar, the cholesterol-based foods, please stay away. So these are some things that potentially could help outside of medication. But if these don't work, then medication is definitely necessary.
Now, something that some people may be confused about: how do we detect hypertension, and how does hypertension affect our bodies?
So technically, you should have 3 different readings that are above the stated number of 139 and above 89 on the systolic side. And if you have 3 independent readings where that's the case, then you'd be labeled hypertensive. So like I said, with that, once you have that, you're at risk for things like heart attack and stroke. So it's important that, very, very important that it's addressed. And a lot of people, they call it the silent killer because people don't feel it. It's very rare that you can actually feel that your blood pressure is elevated. But you walk around, you don't feel like anything's going on. Next thing you know, unfortunately, a bad catastrophic event can happen.
All right. So, Dr. Lewis, from your lens, Are there barriers in the Black community around access to care? And if so, what steps can we take to overcome those barriers?
So yeah, there are barriers, and I'll go through three of these. Okay. First of all, I think it tends to be socioeconomic. Unfortunately, in the Black community, the unemployment rates are higher, the underemployment rates are higher. Once you have that, employers usually are the ones that pay for health insurance, and if you're not employed or underemployed, that's a barrier. That's a problem. So, this is an issue, number one. Number two, when we did the vaccine project that I mentioned earlier, we did a little research in terms of healthcare specifically in the Black community. And did you know, James, that if you were a slave and you didn't want to be a slave, this was considered a medical problem. And the cure for this would be amputation. So this is, 150 years ago, what the thinking was with healthcare in the Black community. Obviously, there's a fair amount of cynicism and skepticism by the Black community to healthcare. Also, the Tuskegee project where syphilis was given to Tuskegee Airmen and studied in terms of its late effects, not good, not a good look. So with that, you will get a fair amount of, I don't trust the healthcare community, and this is a barrier. No two ways around it. That said, the third barrier is, do we have enough Black providers? And especially in 2020, I've received a large number of new Black patients, because Black patients want to seek out a Black provider. So, and I feel that we don't have enough. So this is a major barrier that I think we need to get more people in the community that are excited about math and science, excited about becoming a doctor or a nurse or whomever. But just we need more people from my community in the healthcare field.
Sounds like a plan. Now, based on your own experience, what advice would you recommend to providers and clinicians that are treating patients in the Black community?
So this is an interesting question, because you don't want to be too pejorative and say, oh, you got to go in there and give us some DAP and they'll identify with you better. No, we don't want to do that. That might be considered racist. So no, that's not what we need to do. I think the best thing would be to listen. My wife says, when it comes to racism and people feeling comfortable, first thing you need to do is just sit down and listen. So I would implore our other healthcare providers here at Providence to, just talk to your Black patients and listen to what they have to say. Ask them about their environment and their barriers to healthcare. And it'd be very interesting what they have to say. Also, there are multiple, the Black community is very complex. There's multiple subtypes and ... So no one fix fixes every communication style. So I'd say just listen.
Sounds like a plan. All right, let me take this question from the chat, Doc. How can workplaces like Providence help their employees reduce their stress levels while working throughout the day?
I have a stress ball. It does. It's a high stress environment, healthcare is, and a lot comes at you fast and furious. It is great during your break, during in between patients, to just take 10, 20 seconds to take a break and think about something else, or just being mindful. That's one way I think it'd be good to try to get over the stress of your average workday.
Okay, I think you faded out at the end a little bit there. Now, another question I have here from the chat. Plant-based diets are growing in popularity. What is your recommendation about introducing plant-based meat into the diet?
Um, the when we know the problems with red meat, we know the problems with fried meats, not good. I am excited. I don't think there have been any studies in terms of plant-based diets and cholesterols um, heart disease risk or anything like that. I have seen no data on that, but um, it has to be better than fried foods and red meat. So I'm excited. I think it really is a sign of ingenuity to think about these plant-based meats, and hopefully the data in the future will bear out that less heart attack, less stroke is caused with those type of diets.
Okay. Now I have another question here. Now I'm a patient, and I don't know what my blood pressure is, or I haven't seen a physician in a long time. What should I come into the office and ask for? I think maybe hypertension runs in my family. What type of labs should I be asking the doctor for? What specific? I don't want to take medication, but what should I come in there and say, Doc, I want this to be tested, or I want to test this to ensure that I don't fall in the same line as some of my family members?
That's a great question, James. So your primary care doctors, I have full confidence that the Providence-based primary care doctors know. So basically, I'm saying just go see your doctor. Okay, they know what to do. They'll do your sugar, they'll do your cholesterol, they'll check your thyroid, they'll tell you what vaccines you need. Hopefully, you've gotten your COVID-19 vaccine. But one other thing that is a relatively new change that is important is colonoscopy used to be at age 50. And for the Black community, they suggest starting at age 45. Now, in the last probably year and 3 months, it's all been ratcheted down to 45. So at age 45, colonoscopy screening for colon cancer risk should start. So, but knowing specifically for the Black community, yes, colon cancer is higher in the Black community. So it is important that if you're above 45 and you do your physical exam, so I would encourage each one of the Black community to get their physical exams done. But if you are in that age range, you should get your colon checked.
Okay. Now, Dr. Lewis, are you guys are possibly considered partnering with any Black churches?
So the Hypertension Project, specifically with the American Heart Association, really outreaches these churches, and they have workers that have been fully trained or checking blood pressures. These blood pressures go back to the American Heart Association, and hopefully we can find a way for it to come back to Epic and have our doctors look at it and make adjustments if necessary. So, but yes, like I said, the American Heart Association has associated with 80 different faith-based and community-based organizations as part of this.
Okay. Another question popped in here in the chat, and this touches on what you talked about earlier about having the access to care. How can we reach out and help mentor our youth and inspire them to be future doctors and nurses?
I've struggled with this question myself, because I feel that so many people have, grabbed me and pulled me up, especially in the Black community, and I want to be that one to our future. And so one thing that I'm going to do the next few months is my sons are part of this basketball program / school, and I want to give a career day in healthcare where we talk about what's necessary to become a doctor, what you have to do as a doctor, the ins and outs of being a physician and working in healthcare. So that's what I propose. We really need to have the youth think of medicine as a viable profession. At FACey, we have something called our diversity roundtables. And one of the issues in the roundtable this month will be a documentary. And at FACey, we are showing this documentary to the medical staff called Black Men in White Coats. Now, as you might know or not know, the number of black male physicians have really tapered down in recent years. I mean, there are multiple medical schools without one black male. And this is not good. Really, for the health of the community, it's necessary to have our physicians' workforce as high as possible, not decreasing. So we're going to show this documentary, and then a week later, we're going to have a discussion about it. And we have a physician here, Dr. Kedia, who's really been the force of this, and he wants to have fundraisers and scholarships and that are FACey based. So he really is fighting to increase numbers of black physicians in the United States.
Now, can our viewers and listeners also have access to that documentary as well?
Unfortunately not. If you're FACey based, provider, yes, but we bought a catalog of 300 slots, and we'll be hopefully using those for our FACey physicians. But it's something that, hopefully Providence can get a hold of and think about sharing that.
Sounds good. Okay, now another question popped in their chat. Has Providence considered using culinary medicine as an added approach to treat our black population, to teach regional cooking in a healthier manner?
I had a board meeting last week, and we actually talked about this very same subject. I think it would be great to have a racially based flyers in terms of foods for the black community, foods that are healthy for the Latino community, and ... So they can be educated what's good, what's not, and know, to stay away from some foods and overindulge in others. So we don't have anything formal yet, but it is simple. Stay away from the fatty foods, stay away from the sugary foods, eat more fruits and vegetables.
All right, Doctor. I think this will be our last question, Dr. Lewis. Is hypertension a hereditary condition? And if so, does that mean a person is predisposed or will get the condition?
That's a great question. And when it comes to 90% of hypertension, the cause is unknown. And when we say it's unknown, that means we're not exactly sure what causes it. 10% we figured out. These are called secondary causes, but essential hypertension, as we define it, means we don't know exactly the cause. There's some hereditary issues there. There might be some genetic issues in terms of your vasculature and ... But at this point in time, it's poorly defined.
All right, Dr. Lewis. So thank you for your time today. I believe we're almost at time. So on behalf of our SoCal Regional Health Equity Team and SoCal Diversity and Inclusion Council at Providence, thank you so much for tuning in today. Should you have any questions, and if you are interested in learning more about our hypertension efforts in the coming months, please email SoCalHTNrequests@providence.org so we can add you to our mailing list to receive important updates. Lastly, we would like to thank our SoCal D&I events and communication members for making this happen. That includes Isaac Luna, Vicki Head, Aziza Barnes, and Kyle Moore. Also, thank you, Dr. Lewis, for joining us today, and to everyone for listening and sending in your questions. If you're looking for medical advice, please visit providence.org. Make sure you follow Providence on social media at Providence on Twitter and under Providence Health System on Instagram, Facebook, and LinkedIn. Once again, thank you for joining us today.
Thank you. Thank you for having me, James. This was awesome. Do a great job.
Thank you, sir. We appreciate your time.